Can techniques for managing neuroplastic pain be effective in small fiber neuropathy? This was a very interesting question posed by some of my viewers on my previous videos there, and I thought I would take this as an opportunity to talk a little bit more about the role of such techniques for proven conditions like small fiber neuropathy. Small fiber neuropathy is a condition where there is a proven change medically in how the small fibers within our peripheral nervous system are affected. Now, as you might be aware, our nervous system is comprised of the really large nerves that come out from the spinal cord. But as these nerves divide and get smaller and smaller, beyond a certain dimension, the fibers themselves are classified as small fibers, typically in your hands and in your feet. And there are conditions where the nutrition or the lack of myelin or protection to these smaller fibers can make them more vulnerable to damage due to lack of nutrition or damage due to any kind of compression or pressure or injury, and that can result in a change in how the nerve signals and fires, and that kind of condition is called small fiber neuropathy. There's evidence of damage to the nerves, the speed can be affected, the quality of the signals can be affected, and it's a typical kind of neuropathic pain. So the kind of pain that comes when you have small fiber neuropathy is what we would consider as neuropathic pain because of a damage to the nervous system. Now, small fiber neuropathies, the examples can be when you have diabetes, when you do have alcoholism, sometimes in conditions of uncontrolled hypertension, and you do have a lot of peripheral neuropathies which do not have sometimes a very clear cause or understanding. You can have that after cancer treatment as well due to the effect of the chemotherapy drugs. So we realize that damage to the small fibers can occur due to a variety of causes, chemicals, toxins, and unexplained causes. But ultimately, there is a change in the signaling, and that means that treating it can become quite challenging. So the usual methods of treatment are what we have for standard neuropathic pain management. So you can have medications that calm the nerves, you can use electricity to calm the nerves, and you can use nerve blocks or sometimes surgeries in appropriate issues to try calming the nerves. The success rates are generally low, and it is often quite a difficult condition to resolve. But what we are now understanding is that in up to 50 to 70% of such neuropathic pains, the sensitivity that happens in the small fibers of the nervous system can start to spread into the spinal cord or the brain, or if there are other risk factors like stress or adversity or other forms of mental health issues, then the pain can become much more intense. And in that situation, this would be almost classified as what we call nociplastic pain, where the entire nervous system has got sensitized on the background of a neuropathic pain. And in that situation, treatments and methods that are useful for nociplastic or neuroplastic pain can be used as well. What are the treatments that can be used for this? Well, it is a more whole person, lifestyle medicine based approach, which means that treatments that are looking at optimizing the sleep, treatments that are optimizing the stress management strategies, treatments that are looking at nutrition and anti-inflammatory diet, treatments that are aimed at looking at movement and gentle movement-based strategies, and finally, mind-body techniques. So typical examples of mind-body techniques may be various behavioral therapy approaches like CBT or ACT, a newer set of techniques like pain reprocessing therapy or emotional awareness and expression therapy where appropriate. You can have movement-based approaches like yoga or Pilates that could be quite helpful. Somatic tracking has been shown to have some benefit in some patients. And then of course, when you optimize sleep, when you take an anti-inflammatory diet, when you have stress management strategies such as breathing techniques or vagal nerve modulation techniques, all of these can be very good ways of calming the parasympathetic system or using the parasympathetic system to calm the sympathetic system. So a combination of these techniques for neuroplastic, nociplastic pain can be helpful in many patients with small fiber neuropathy, and they must definitely be discussed with your pain specialist to see which one of this could actually be more beneficial for you and help make a difference with your small fiber neuropathy pain. I hope you found this video useful, and I look forward to seeing you in the next one. Thank you for watching this video. I hope you found this of value. Don't forget to hit the like button and subscribe to my channel for more videos on the understanding of pain science and lifestyle medicine.